19, 2021. Good afternoon, Madam Commissioners.
Good afternoon.
Yeah.
What I would like to do, my colleagues, I wanted to let you know that due to the change of status in Hamilton County, I thought it was befitting for me to say a few words as it relates to our purple status now. Of course, I will give you guys an opportunity if you'd like to also say something. So I'll just start. I wanted the people that are listening to know that as we look at our population, Indiana has 6.7 million people. Kentucky has 4.4 million people, and Ohio has 11.6 million people. And the reason why I bring that up is for several reasons. The numbers of contacts that people would have in Ohio is far greater than either one of those other states. In addition, when we look at vaccines, the need for more vaccines, of course, because of the population is so much greater. And of course, I also bring it up because we look at cross-contamination, and these are only my words, as it relates to people that live in other states coming in for work and then going back home. So all of those states just interacting together on a consistent basis impacts our level of virus and contact. Now, the governor has designated Hamilton County during this pandemic as having the highest spread, highest exposure, which means, as I said earlier, our county is purple for those of you who don't know it. And we always like to spotlight our county for the great things that we're doing, but we certainly don't want to be spotlighted for this reason. I believe we have, when the governor looked at it, we had reached 6 of the 7 factors that determine whether or not we will be purple. So I believe that we can defeat this purple monster. So I started thinking about the message that we've been giving, wear the mask, 6 feet apart, wash your hands. And, we've always been told you do the same thing over and over again, you get the same results. That's insanity to think that things are going to be different. But I beg to differ for that. We keep saying the same things. People keep hearing the same things, but are they doing the right things? Because if we were doing the right things as it relates to those 3 things that the commission has talked about and Commissioner Kesterman has talked about, would we be at the point that we are now? So when we're in purple, it means there's an advisory that we only leave home for supplies and services, and that's only an advisory. We have no authority to mandate that. But I know that the governor will be speaking later today. I don't know what he's going to say. But what I do know is, as residents of Hamilton County, we need to determine our own destiny. Only you can save you, and only we can save us. So as I said, later on today, he may decide something differently. And lastly, what I'd like to say is those people that are in the positions of power and authority as it relates to businesses and political positions, please be a role model for the citizens in Hamilton County. People are very confused when they see others that are in positions of power that are not wearing masks, that are not 6 feet apart. So I'm just imploring that not only we ask our residents to try harder and do better and try the mask and see if it works, but also I'm asking our public officials, our businesses to please follow the rules that the board has been asking you to do, because people are very confused. And those are all the comments that I have, but at this time, I'd like to open it up for Vice President Reese, if you have anything you'd like to say.
Thank you, President Dumas. And I do want to add a couple things to that. I want to first of all thank Health Commissioner Greg Kesterman. Last week, we did a video interview that we did through Zoom to explain to people it had just went purple and what that meant, and also to help talk about, because we can't talk about it enough, what the rollout is. I know Commissioner Driehaus gives the briefings on Wednesday, but we all have a part to do to echo that and break it down to people so they can really understand it, because they are getting so much information. We are not limited with just Hamilton County information. We look at other places. People would ask me, why can't we do Paul Brown Stadium to do the vaccine shots? He was able to break that down, that we don't have enough to do something like that. When you're talking about 500, doses here and 500 doses there, I mean, we have probably not enough to fill a library. And so we're not getting enough. And so one of the things that I would like us to do, and I'm going to bring the resolution forward in our next meeting, is that I think that as the governor, and I appreciate the work, this is a tough job to do, but I do think there needs to be a better rollout. If we are purple, if we are at this status, then I think that the doses should follow the people that need it, those counties that need it the most. And so when we're talking about 800 doses and 48 partners, and I know that we have been on the calls with the Ohio County Commission Association, and we're all together trying to work together. But I think we, if he says no, it's not because we didn't ask, and asking in a public way. But I think if we're purple, we need help now. We need help to get these vaccines, to get these numbers down in our county. So that's one of the things that I would like to do as it relates to this issue. There's a lot of concern. I got a couple calls this morning about what is the schools doing, and the mixed messages there. Some are saying that they have to go back to school in order to get the vaccine, or they don't have to go back. I don't know what that is, but we should maybe have someone on from the schools to talk about that, because that is the issue that I've gotten calls from parents that have some concerns about that issue, even though we're not the school board. But certainly, if we're talking about being purple, well, that's something that we want to consider. So there are a lot of things. These things are changing at a rapid speed. But I do think that our health commissioners throughout Hamilton County, the county commissioners, health commissioner, the cities that have health commissions, Springdale, Cincinnati, Norwood, all hospitals, they're all doing a good job of coordinating for the first time. But it's hard to coordinate if we don't have the tools. And we've got to really continue to put some, if you will, to be able to talk to the governor. We're on the ground. We're here with the people right in front of us, and we're the ground people. But I think that we need to look at this distribution plan, because if we're purple, I mean, usually when somebody is sick, that's where you bring the medicine. And so I think we could do, at least be on record and have him to look at that and reconsider it. So we're not just having his press conference where he said, oh, they're purple. Well, we need some help. So that's kind of what I would recommend, something that I want to put forward to at least put on record and send something to them, and see if we could get some additional help down here in Hamilton County. But I do agree we continue to do the regiments that they have told us to do, wearing a mask, washing our hands, stay 6 feet apart. But at the end of the day, we also need to make sure that we have access to the vaccine. And then lastly, I wanted to put out, there was a national article out talking about some other states, some other areas where they couldn't keep the vaccine. They were throwing some away because, it requires a refrigeration and it's very technical. And so I would like to also be able to get the numbers to make sure that we're doing everything we can, not to have any that will go to waste. I know that Commissioner Kesterman talked about that, but I think if we could get that information out to people as well, because we can't afford for any dose to go to waste. So those are my statements. And as we move into a new presidential, hopefully very peaceful transfer of power, and the new administration comes in, and I understand Jeff has sent us a memo on what they want to do as it relates to getting these doses out. I'd love to be able to share that with the public, and for us to be front in line, say, hey, we're purple, we need to get something on the ground fast. So those are my comments. Thank you.
Okay, thank you. Commissioner Driehaus.
Yes, thank you, Madam President. Just a couple of things. So I agree with what's been said. We're getting about 8,000 doses a week in Hamilton County. Much of that is going to the hospital systems, and our public health agencies are getting just a fraction of that. That said, we're trying to get folks vaccinated as quickly as possible. We just don't have the doses to vaccinate the population that's eligible, and we just don't. And we won't because the eligibility is going to expand before we get enough doses to do just the 80-year-olds. And the following week, we're going to have 75-year-olds come on, and then the following week it's 70-year-olds come on, and you can see how exponentially that population of eligibility grows, yet the doses don't follow along. So we're going to be at a significant disadvantage here when it comes to certain expectations of the community, and I get it. And so we're trying to make the contact as easy as possible. And so we do have, we've stood up two things. One is the Test and Protect Cincy.com website. It is a navigation tool where people can go and they see all of the entities that are distributing vaccine in the county, those being the hospital systems, city public health, county public health, Kroger's. Those that have little clinics have about 100 doses apiece. So they're on the list. And then people can click on to their provider of preference and get signed up, get in the queue. And they can go to more than one if they want to. But that information is available on that common website. And then we also have, for those that don't have access to the internet, or maybe a senior that's not comfortable jumping on the internet, we've got a hotline in coordination with United Way. It's the 211 number. And I understand that they were pretty busy over the weekend fielding calls. I'm very, very grateful. And I know we all are for the work that they're doing. But the 211 hotline also is a navigation tool where people can be directed to their provider of choice and get signed up to get the vaccine. So those things were stood up on Friday. John Cranley had the idea to try to centralize some of this information. And so we happily, in collaboration with him, helped to set that up with the hospital systems and Kroger. So anyway, that's happening. But I agree with both of you. We're in a bit of a spot where purple, we've got more spread than ever in Hamilton County, and we are simply not getting the number of doses we need to address the issues. So more to come, I hope, from all three of us as we continue to message out to the community how to, safe behavior in the meantime, right? Commissioner Dumas, you've said it, right? Just do what we need to do and what we've been doing while we wait to get vaccinated. So thanks for the opportunity.
Okay, thank you. And I really want to thank Commissioner Kesterman and Nick Crosley, who's our EMA, Emergency Management Director, for their forward thinking as it relates to making sure when those vaccines come in that they are housed so they can stay cold and stay refrigerated. And we've expanded our ability to do that because we certainly don't want to waste any. So thank you, both of you. So with nothing else being said, well, Jeff, did you want to have anything to say? County Commissioner?
Not on the vaccine
Okay.
issue, Madam President. Thank you.
Okay, thank you. So our first item on our agenda is the 911 communications potential Hamilton County Norwood partnership. And I know either Holly or Jeff are going to lead this off. And I see Andy Knapp is also on our screen. So whoever would like to start.
Thanks, Madam President. I appreciate it. I'm just going to be very brief here and turn it over to Andy. Holly was going to lead, but Holly, I think, is doubling up in an office to try to preserve internet capacity here. So, but just briefly, as we start this discussion, as the board is aware, the county has numerous functions that the county does as it relates to public safety, and not the least of which is the operations of an emergency 911 communication system on behalf of most of the unincorporated areas and other political jurisdictions within the county outside of the city of Cincinnati. So Director Knapp is going to go over most of the data and talk a little bit about the particular opportunity in front of us right now. But from a policy perspective, the county has for decades prioritized the reducing of fragmentation and promoting consolidation within our emergency communication system, recognizing that when it comes to emergency communications, it's important that we are seamless and that we promote interoperable communications between the county and all of our separate jurisdictions within Hamilton County. There's always a lot of talk about shared services and shared services opportunities. Well, this is one place where the county does that very well. Andy will have the exact stats, but I know we serve the emergency communication needs of over 100 police, fire, and EMS units or organizations in Hamilton County. As of several years ago, we were down to, I believe it was 4 PSAPs remaining in the county. We had Hamilton County PSAP being a public safety answering point. We had Hamilton County, City of Cincinnati, Amberley Village, and Norwood. Amberley Village came on board with the county back in November of 2018, leaving us with really 3. Compare that to some of our urban county partners. I don't have the exact stats right now, but I know as of several years ago, there were 47 PSAPs up in Cuyahoga County. I think there were somewhere around 15 PSAPs in Franklin County. So a lot of what the county has done is tried to drive that consolidation, reduce fragmentation. The budget passed by the board over the past 2 years has reduced the cost to jurisdictions to join our consortium. We lowered our detail rate from $16 to $10 and then down to $5 this year, which has had the desired effect of keeping that shared service environment and promoting the reduced fragmentation and promoting consolidation. So, and that has led us to where we are today with the opportunity to discuss an additional expansion of the partnership to include the city of Norwood. This is not a done deal yet. Andy is continuing these conversations with the city of Norwood. I know they're continuing it at their council level, but we felt it was appropriate to have this conversation today with the board so that as these conversations continue down this path, the board is up to speed and has had the chance to ask the appropriate questions to the director, to the administration and the director of our communication center as well. So with that, I'm going to turn it over to Andy for a more in-depth assessment as to where we are right now and certainly to entertain any questions that the board would have at that point. So Andy?
Good afternoon, commissioners, and thanks for the opportunity to speak to you. And Jeff's exactly right that the budget adjustments that we've made as a county to make this service more affordable to our users is now showing even further results that people want to take advantage of the consolidation. They want to take advantage of the technology. They want to take advantage of the service that's available to the other municipalities in a more cost-effective manner. So, I provided a document that kind of sums up the majority of what this initiative is. The Hamlet County Communication Center is a very long and storied heritage of providing this service to our residents. We've been in operation since 1949. And in fact, many years ago, as communities started to look at consolidation models, we've been modeled throughout the nation as a model consolidation effort in being able to provide the 911 telephone call taking process along with the radio dispatch process for the municipalities that we serve as residents. So I always tell people this is my absolute dream job. This is the place I want to be. This is I've spent my entire 30-year career in the 911 business, and I'm quite proud of the work that we continue to do. And that work actually comes on behalf of the legislators like yourselves who have made the budget strategies happen in a manner that then benefits everyone throughout the county. I've been in talks with the city of Norwood in the 4 years I've been in the position I'm in. Each year this has come up as somewhat of an annual exercise to look and see where we're at, look and see what the cost measures are in place for the county, and see how we can better serve the residents of Norwood. And this year it looks like that this is coming to fruition at a call this morning with the fire chief, who is somewhat the lead project manager, if you will, on this project to make that transition. And he confirms that although there are a few political hurdles that they continue to have, we have a target date of February 1st, which is looming very closely for us to make this happen. It's a combined, consolidated effort with the City of Norwood administration, the police chief, the fire chief, and the mayor to make sure that it's a seamless transition for the residents. and that the residents don't see a drop in any type of service whatsoever. We've done, or I should say, we have scheduled training for the responders. You know, when you change a major system, it's not just the 911 system. It's not just the way the calls come in. It's also the way the calls are dispatched. And so the police and firemen are going to have to go through a training about, you know, how we do things in the county environment. And then in addition to the police and fire personnel and the line responding personnel, you know, our own dispatchers, we've not had a lot of exposure to Norwood. And one of the things that is always a challenge for us is that when we hire folks for the dispatch positions, you tend to grow up in a certain neighborhood of the county, and you tend to be used to that. You know, example is I grew up in the west side of town in Miami Township and live in Green Township. And then suddenly I took a job in Sims Township in Loveland and found myself completely lost and not familiar with not just the geography, but also the philosophy of the departments. And ultimately what we want to do is make this seamless, that regardless of what operator for us answers the phone, that we have a working knowledge of the community that we serve. And we have, you know, electronic means for doing that, but that also means training for our staff. So we've developed training that our staff will go through. We work with Norwood to try to identify their hot spots, if you will, identify their areas of the landmarks that they're used to describing. And at the end of the day, you know, I want to make this the best that we can for the residents of Norwood, for the responders in Norwood, and then again, you know, for our dispatchers here. We've also extended the opportunities, as with any consolidation effort that goes on. There are people that are going to suddenly find themselves without jobs, perhaps. And the city of Norwood is doing a very good job of working with their employees to determine how many of them would be interested in positions with the county, or how many positions they have within Norwood where these folks can relocate. So we've worked very closely with Norwood's administration to make opportunities available, you know, where it's entirely possible. So with that, I'm available for any questions you may have. If there's anything else that we need to elaborate upon, I'd be happy to do so. We expect, based on the data that we've received from the city of Norwood, we expect to be able to absorb this additional workload, this additional call volume, with little impact to our overall operation, which means there's, you know, I'm not going to come to you for an increase in budget requests at this time, or I'm not going to increase our personnel costs at this time, as we continue to evaluate it based on the statistics that Norwood gave us. It'll be interesting to see when the statistics that they provide versus what happens when they come into our environment, what the reality is. So I am a tad bit guarded, to be quite honest with you, only because, you know, we've never absorbed a municipality of that size. Their size, we've estimated, is similar to Springfield Township in that the number of responders they have, the call volume that they have. Nonetheless, based on the analysis that we've done, we're comfortable that we can absorb them with not just the no budget impact, but certainly I don't want to negatively impact the service level that we provide to any of our residents, or specifically to the residents and the responders that are the city of Norwood. We're going to put them into we have 3 geographic sectors for our law enforcement dispatch, and we're going to put them into our East radio system. The analysis that we've done is that even with adding their radio traffic into our East radio, that it doesn't make it any busier than our current West radio, which the West is our busiest radio as law enforcement wise, because of the territory that they serve. And so our analysis is that they can come into the East radio and still be less busy than what our current busiest radio is. So with that, I'm available for any questions. We are hopeful that this will transition on February the 1st. Again, we have a couple of legal things to tidy up. Nonetheless, we want to be responsive to the administration's timeline that they want to make this switch happen by February 1st. There's a lot that goes on in the background as far as the coordination with Cincinnati Bell for 911 provision, for example, for the way that the city of Norwood interacts with RCIC, our criminal computer system. There's a lot of behind the scenes, a lot of staff hours that we have into this. As I said in correspondence, this most recent concerted effort, I would say, began in October, and we've been working very diligently ever since to make sure that this happens without a hitch. With that, I'm available for any questions you may have.
Thank you so much for your summary. I'll open it up for Vice President Reese if you have any questions or comments.
Thank you, Madam President. I know that I'm entering only my third week here as a county commissioner. And we've been having a lot of issues with IT on getting emails. And I know myself and Commissioner Driehaus are both here in the office, and sometimes it's hard to even be on this same meeting without getting thrown out, cut out. And so I guess I got a couple questions. One is, was there a report that I was supposed to receive on this that you're talking about, Andy? Am I following you? Was there a report that maybe my emails didn't get to me?
I will, if I could, Madam President, the report that Andy's referring to was submitted in my weekly report this week, which would have come out yesterday, Commissioner.
Okay, because our emails are getting very slow. Hopefully I'll be up to par with emails and phones working, which brings me to my next question.
Sure.
I represented Norwood as a state representative, so I'm very happy that we're able to help provide some good services. And certainly everyone has been talking about how do we consolidate services to be effective and work together. So I'm all for that. I just want to make sure that that technology that we have, because we're in a small space here and our technology is not up to par, and we're not dealing with 911, at least we hope we won't be dealing with 911, but we are dealing with the public's business. And so I just want to make sure that our technology, our IT, everything is on point and will be able to absorb this in a seamless way that is forward. Because I can understand how we could have great IT here, but then just our little office, we can't get good IT. So I just want to make sure that our technology, because like you said, Andy, this is a big thing that we're doing, absorbing what's happening in Norwood. And I just want to make sure we can't afford a second or going down or internet running slow or phones not working. Some of the things I've kind of experienced just as a commissioner with a very small office of just 2 offices. So
Sure.
Could you talk about that?
Sure. No, I understand. Appreciate that. And actually all of the IT comes under my command now. So the situation that you're experiencing at the administration building is on my radar. And actually there's work in progress with Cincinnati Bell to completely resolve that for us. On the 911 side of things, the 911 system is a completely independent network. We actually have a connection to a national 911 provider that has duplicate measures in place. So when it comes to 911 systems and 911 networks, it's a little bit different from what traditional internet is. We do, in fact, though, use the same internet pipeline that you're on ultimately. And despite there's significant separation between those networks, the use for us and the experiences that you see are a little bit different in that we don't use the internet per se. We do, but we don't have that reliance on it because our internal networks are communicating with each other. I'm confident that what we have in place today is we're already serving, the 47 other municipalities that we're up and running. We have good bandwidth. We have, and I know with being new, I'll give a quick overview of there are major components in the dispatch world, and starting at the call taking system. Our 911 system was completely overturned and completely renovated, if you will, just 2 years ago. So in 2019, that was a complete overhaul that we did. The computer-aided dispatch system was new when I got here. That was rehabbed in 2015. But again, we keep up on that. So the computer-aided dispatch system, the hardware itself is due for an upgrade. That's already been budgeted, where we paid with some monies from last year and some monies from this year. We're going to go towards a complete overhaul of the virtual server farm that we use to house that CAD software. And then the final component would be the radios. So if we have the phones, the computers, and the radios, the radio system is a state-of-the-art Motorola P25 radio system that again, was completely overhauled in 2015. It has about a 25-year life expectancy. We are on the state of Ohio Marks radio network, so we have complete interoperability throughout the state. And in fact, kind of excited, it hasn't really hit mainstream yet, but state of Kentucky and some of the Northern Kentucky communities are going to a similar type system that we'll be able to interoperate and give our responders who are on the riverbanks, for example, a little bit better interoperability with our partners in Kentucky. So I'm confident with, and trust me, if there was something I needed, I would be the first one to be at Jeff's doorstep explaining what we need. And although I have an absence of a written down strategic 5-year plan, we are working towards that. The good news is that a majority of our main, larger, very expensive capital items and systems that we have are top notch and are in very good working order. And we continue to monitor that for any type of upgrades we can do. But I'm confident with what we have right now. And I'm also confident that we're going to resolve your office issue. The COVID event, to be quite honest with you, has had such an impact on us, network wise, that it used to be a very simple project of going to see individual employees and resolving their IT issues. And now our employees are scattered, in their own homes and dependent on whatever network they have in their homes. It's kind of out of our control. And but nonetheless, it used to be I could send one person to the 6th floor and get that squared away, within a relatively short order. Things are a little more complicated, a lot more external connections coming to us, a lot more double connections where, a video system, for example, may use the internet to connect outwards, but then it also uses the internet to come back in, and it doubles the bandwidth needs. So the bottom line is I've been in communication with Jeff and Holly, and we've got what we need to resolve the issue that we think we are experiencing now. And I'm on standby, ready for the next issue that comes up.
Thank you. I want to thank you. Thank you for that clarification. I just wanted to make sure, because that got me a little nervous when I walked in. I've been at the city and the state, then I get to the county. I'm like, my gosh, what's happening? Emails, those kind of things. So when you talk about 911, I'm glad you telling us and the people that we are on different networks. And that's why I've come down here for the last 3 weeks to make sure that we can communicate. So I'm happy to see what we're going to be doing and making sure that we're investing in the future, because this is really the future. I mean, this is how we're going to be interacting, and it'll be even other things where we'll be able to interact and be accessible to the taxpayers and the citizens. So thank you very much, Andy. I appreciate it.
Thank you.
Thank you. Commissioner Driehaus, you have any comments or questions?
Yeah, thank you. I am very excited about this item. I think that the city and the county have their own systems, but to bring Norwood in kind of as the last outside the city and into the county system is a big deal. And so I think it'll offer some continuity of service. It's going to save Norwood money, and it's at no expense to the county. So I think it's really a great step. Kind of, it seems like a bit of a final step here in trying to make sure that 911 call traffic is efficiently run all from the same place. And so I think that's great. I did ask a question of Jeff, and I just want to clarify that. So the 911 calls go into the 911 centers. And so now there will be one, the county and the city, and that's it, just those two. But we still have communities that when that happens, the call then, in some cases, we go straight to the dispatch ourselves and dispatch the first responders. But in some communities, and there aren't many of them, that call goes out to an additional dispatch in that community, and then they are the ones that contact the first responders. And so, Andy, I guess my question to you is, are we moving to try to consolidate, or at least have those conversations with some of those outlying entities to bring that also into a central place, in addition to the work that we're doing here with this item?
Traditionally, that's a great question. And traditionally, the communities that are doing that are doing so because they've done what they're doing for many, many years. Or it may be a choice of the type of standard of care that they want to do for their community. So the current communities that are not radio dispatched by us include the city of Reading, the city of Deer Park, Amberley Village, Indian Hill, and Amberley Village. And Amberley Village does both police and fire and EMS dispatching at their center, although we take their 911 traffic. Indian Hill dispatches the Rangers only. Deer Park does only their police department. And then Sims Township and the city of Loveland have their own dispatch center for both police and fire. Sim Township and Loveland are a little different in that, and I have some intimate knowledge of their system. They're politically, they lie within all three counties, so they have territory within Hamilton, Claremont, Warren County. So they're kind of they consolidate from the activity from all three counties into their dispatch center and handle the dispatching for their police and fire and EMS folks. So conversations are always in place, and I think that the reduction of the user fee for many years, the user fee has always been the unknown, and in addition to the reduction of the user fee, even the estimation of how we come up with at the communication center what your annual fee is going to be. Just this year, we met with our board of advisors and suggested that, okay, we want to do a 12-month look back in order to give an accurate estimate of how many dispatches you've had through our organization. But instead of waiting till December to tell you what then January's bill is going to be, how about if we adjust that and we take the 12 months from June to July? That way you have a little bit earlier notice of what your fee for the year is going to be. So that's another enhancement that we've done. So we continue to look at what are the things that are prohibiting municipalities from coming on board to us. And if we can show, and as Jeff's recommended budget shows, there's a 5-year projection that indicates, the continuation of a low 911 dispatch fee. We continue that and demonstrate that there is long-term and the longevity in that budget. Then I think you'll see more and more communities continue to come on board.
Okay, great. Well, thank you again, Andy, for helping make this happen. I know it's not final because Norwood, I think, still has to vote on it, but I really do think this is a step in the right direction. And again, great for Norwood and really great for the county. So thanks so much for your work and making this happen.
You're welcome. Thank you.
Thank you. Andy, just a couple comments and questions. I apologize if I missed it, but as it relates to Norwood and the percentage of increase of calls for the 911 system, what are you thinking if they come on, what that percentage would be?
So it's roughly the estimates that we've come up with is that Norwood does about 22,000 911 calls a year. Last year we did 249,000. So there is about, an 8 to 10% increase in our call volume. But as you take those metrics, that 22,000 number, and divide that by 30, then divide it by 12 with the number of months, and then divide that into 30, the absorption of that in our current environment should really, not prove to be a challenge whatsoever. And I even look at the metrics that we look at, for example, our call answering times. How fast do we answer our calls? And there's actually state legislation that requires us, in order to receive our wireless government assistance funding, we have certain performance metrics that we have to hit. And we consistently hit those with plenty of bumper room, if you will, to adjust. We've not had an issue with our call answer times. So based on the data that Norwood has given us, based on what our current data is, I see no impact whatsoever.
Okay. And then you said February the 1st, you'd like to get it done. Is that, where did that timeline, is that when everybody else signs or what?
That is actually Norwood's intention. Norwood is trying to start a new month, and so that their statistics and everything with regards to their response and the handling of their system. They wanted to get it by February 1st. I think that our timeline is, I can really the first of the month, there's no I can do any day. An example is when Amberley Village transitioned to us, we did it, I think, in the 18th of the month in November. I mean, so for us, just knowing there's the technology side of things, operationally, we can do any date. It's really not. That date actually was set by the city of Norwood.
Okay.
And as recently as today, they confirmed that that's what they intend to do.
So it makes a lot of sense to pull Norwood in, considering they are the second largest city in Hamilton County. I was just wondering, they have been a little hesitant to want to be a part of it. And is that because you think like Reading and Eberly and all that, that they want their own autonomy? What do you think the hesitancy has been?
The hesitancy has been the budget aspect of things. They want to see the longevity in the user fee. You know, when we went to $10, that was a very aggressive move. Now we've gone down to $5, and it's even more aggressive. And so they were able to in their budget analysis, if you will, realize that if they're going from what they believe is their spend is currently $1.2 million down to the $130,000 that would be now, you know, that makes it, even if there was a significant increase from that $5, their significant increase gets them nowhere near the 1.2 million that they're spending currently. So in addition, you know, change is quite difficult. It's hard when you've done something a certain way for so many years and you have had your own for so many years. There's a perception that that there's going to be a degradation in service or a loss of response time. And we've answered those questions. We do this business every day for the other municipalities already. And while I understand their hesitancy, and I understand that there is a difference between the small town when you know who exactly you're answering to when you go into a high volume call center. But nonetheless, we've done an awful lot of work on our end to make sure that our customer services match that of what's expected at the small town level. And the reality is, yes, we can't possibly know every intimate detail of that community. Nonetheless, we have the mechanisms in place that we can always reach out to one of the police officers and say, we've got an unusual question coming from residents. You know, our job here really is to put the public in touch with the responders. And we do that in a very high volume way, you know, very, very well. And of course, you have things that don't always meet exactly the way things are, but we have instant and immediate access to the responders in that territory. So it's changed. I mean, really, that I think, you know, a change that of something that's uncomfortable and that they're not used to and not certain what the future holds. And so we've done everything we can to try to alleviate that. And I'm looking forward to, you know, let's get them on board and then get into the routine. And of course, we'll have problems and issues are going to arise. That's the nature of any kind of change. But I'm quite confident that the staff that I have here, the management staff I have here, and the management command staff within the city of Norwood are prepared to handle just about any situation that should confront us.
Okay, thank you, Andy. And we'll be hearing back from you once, I'm sure, Norwood Council talks about it and confirms it. And we'll hear back from Jeff how we need to move forward.
Madam President?
Yes.
Can I ask one additional question?
Absolutely.
Yeah, just out of curiosity, you mentioned the employees in Norwood. How many employees are there?
So they have 8 full-time employees in their dispatch center right now. Out of the 8, it's my understanding from the Norwood officials that 5 are being offered positions to relocate. The other 3 will not have a position ultimately. And out of those 3, I've gotten 1 application from one of the Norwood dispatchers already. And so we did offer them the opportunity to apply within our organization. Certainly we, if you have the expertise and the skill set and the experience in doing the type of work that we do, quite frankly, we have a very difficult time in finding good quality candidates that understand the nature of the business. So we've offered them the ability to come on board to us as if they are interested.
Thank you. Appreciate it.
Great question.
Madam President,
Yes.
If I could just chime in just to answer one question that was asked a little bit earlier to Commissioner Driehaus's comment about what I think she's referring to as the PSAP associate environment we have. I just wanted to make it clear as well that even with the PSAP associate environment we have, which is where we take in the 911 calls and transfer it for dispatching, over the years, we've continued to make progress in whittling that down as well to, again, centralize those points of communication with the county. I know when I first got here years ago, we were just bringing Wyoming in from its relationship as a PSAP associate. I think last year, Andy, we internalized St. Bernard in the same way. So we continue to make progress in that way as well, with the idea being that the fewer points of connection, the better for seamless communications. And then finally, just a quick note, as we talked about the staff, I never try to let a communications discussion go by with just without thanking the staff out there that do just such a great job. And as the board knows, and Commissioner Reese will learn over the course of the year, I don't know that a year typically goes by when we don't hear something about the passion and diligence level of the staff, Andy, that you have out there, the communications operators, the radio operators, whether it's a story about delivering CPR instructions, delivering a baby on the side of the road, or even God forbid, just responding with grace and tact to some of the most horrific situations that we have happen, and they do it in just such a professional way. So I just wanted to leave you, Andy, with if you could pass along on behalf of the board and the administration, the thanks for all that they do.
Certainly will. Thank you, Jeff.
Right. Thank you, Jeff, for saying that. That goes without being said for sure. The great work. So thank you, and we'll talk to you later.
Sounds good. Thank
Stay
you.
on if you'd like. You're welcome to stay on. I'd like to make a general comment as it relates to our computer issues. And what we did in our budget, we did allocate additional monies to upgrade the computer system, which does not help right now when you're having problems with it. But we did incorporate an upgrade in our computer system because we were aware of the many problems that we experience with our computers. So. Okay, I'll go to our next agenda item, which is the JFS Fatherhood Initiative update. And I do see Director McCartney is on the line, and I believe Michael Patton is also going to be part of that discussion. So Tim, would you like to get started on that?
Absolutely. Good afternoon, commissioners. Pleasure to see you. And my role in this is really the Don Pardo role because Michael and Calvin Williams, who probably could be known as the father of fatherhood initiatives in Hamilton County. He's been at this a long, long time. They're going to handle the presentation. Calvin's going to run it and talk through it. And then Michael will also chime in and they will answer any questions. I unfortunately have to go to another meeting, but you're in very good hands. And Calvin is also, I think, after you see what he's going to present, a budding man on the street reporter. And that'll make sense after you see his presentation. But thank you very much for allowing us the time. Fatherhood is something that these two guys have really moved forward in Hamilton County and are looking forward to taking those efforts even further. So thank you again for allowing us the time to present to you.
Thank you, and welcome, gentlemen.
Thank you so much. Madam President, I will start off. I'll do a brief introduction as well. Thanks, Tim. Also, County Commissioner, Vice President Reese, County Commissioner Driehaus, thank you so much for having us and give you some background on what's been happening in the world of fatherhood in Hamilton County over the last several years. So Calvin is going to share his screen. We did try to send over the presentation a little earlier, but it has some really good video in it. So it was a little bit too large to send in an attachment, but we will make sure that we have that available to you all after the meeting. So you have it in your record. But first thing I want to do is just let you know that back in 2012, the Cincinnati Human Relations Commission received a $10,000 grant from the Ohio Fatherhood Commission to stand up a fatherhood initiative in Hamilton County. And fatherhood has actually been around for quite some time. You guys may know Talbert House does a really good job with programming around fatherhood in Hamilton County. It has done so for years. This initiative was a little bit different. However, this initiative was, the idea was to really bring in more county participation, more voices into the world of fatherhood. So between 2012 and 2016, I became part of a group that was asked to participate with the Cincinnati Human Relations Commission. Some of you may know well about the Cincinnati Human Relations Commission over at the city of Cincinnati to stand up a fatherhood initiative in Hamilton County. My role was really unique in the sense that I was asked to participate. At the time, I was a section chief in child support. And so fatherhood and child support crossover in many areas. And so I participated then, and we were pulled together a group of Hamilton County individuals and organizations to figure out what we would do with the seed money, this $10,000 seed money, to assist with spreading the word of fatherhood and making sure fathers were connected to resources in Hamilton County. So during that time, what we decided to do was hold a resource fair, an event at the Community Action Agency on the Friday before Fatherhood, starting in 2013. So what happened essentially is that we were able to do that. We brought in providers like 4Cs to handle childcare. We had keynote speakers to participate, and we would have booths and information from child support and reentry and legal aid and other programs and services that we knew were going to be important for fathers in Hamilton County to hear about. And so that's essentially what we did with the money over a 3-year period from 2012 to 2016. And we knew that at that time, it was really lifted, and the work was done by volunteers that had full-time jobs doing other work. And so I began to look around the state, look at other models in the state for how we could implement something more sustainable in Hamilton County. And 2 of the counties that I know were doing a really good work in that space was Cuyahoga County and Montgomery County. And the one common denominator for both of those counties is that they had a funded position. The one in Montgomery County had a funded position under Job and Family Services. In Cuyahoga County, they have a slightly different scope, but they have broader funding for a position under the Board of County Commissioners. So I began to think about what we could do here in Hamilton County to fund that position. And so I really took a model from Montgomery County, decided to write a position description and develop a fatherhood coordinator position that would be responsible for doing the outreach and bringing in other participants in the county to do work around a collaboration model. So not necessarily to provide programming, because we have a robust, like I said, a robust infrastructure for programming in Hamilton County, but really to do a convening, bring together a group of individuals and organizations who do work with fathers on a regular basis to talk about the issues that confront fathers. And so in 2018, we were lucky to have Calvin Williams still working in the county. Calvin has been doing work in the space for 20 plus years, and he is one of the initial founding members of the Ohio Practitioners Network for Fathers and Families, and he is very familiar with the needs and aspirations of fathers. So I brought Calvin on board in 2018, and he had begun doing work internally and externally with the Fatherhood Collaborative of Hamilton County. And before I kick it off to Calvin, the one thing I do want to point out that's important is that the funding that came from the Ohio Fatherhood Commission was county specific. So when we developed this initiative back in 2012, 2013, and we brought together a group of community members who were interested in this work, we decided to name it the Fatherhood Collaborative of Hamilton County because it was county specific. And it just so happened that in 2018, as I began to think about how we could continue to do this work more consistently for the county, that it came under the Job and Family Services umbrella. So the name of the collaborative is the Fatherhood Collaborative of Hamilton County. Calvin Williams is our Fatherhood Coordinator under the umbrella of JFS, but really this is a county-wide initiative. So having said that, I will turn it over to Calvin, and he can talk a little bit further with you about what we've been doing since then.
Thank you, Michael. Thank you, Madam President, Vice President Reese, and Commissioner Driehaus for allowing us to present today. So as Mike talked about, we reestablished the Fatherhood Collaborative in 2018. During that year, we convened a very large and diverse group of county stakeholders to talk and think about the next iteration of the Fatherhood Collaborative. And we used that wisdom and guidance very specifically as we designed the collaborative that we have today. We started meeting again in February 2019. And you can see there the mission that was created to represent this version of the collaborative, to create consciousness, conversation, and action on the needs and aspirations of fathers and their contributions to healthy children and families. So in 2019, what Tim was alluding to, I went around the county with my cell phone and asked fathers to talk about what being fathers meant to them. And so we put together a little video to share Hamilton County fathers talking about fatherhood and what it means to them.
Deshaun, this is Paisley Harris. And I just want to say, like, being a father is the most amazing thing in my life. It really changed me for the better, matured me, and it's just like she warms my heart in the darkest times. And I just love her.
Hi, I'm Cliff Gears. I live in Hamilton County and I love being a father. I get to be an example to my son, someone he can always rely on, and one day I hope to be his friend.
All right, my name is Joe Dowd. I'm a dad. I love being a dad. There's nothing better. It means the world to me. I wouldn't trade it for anything in the world.
Craig, and being a dad means responsibility. Putting family first and me second, or third, wherever it goes. That's what I say dads are.
My name is Mark Wilbur. I have 3 daughters. I have 5 grandchildren that mean the world to me. I would do anything for them. They are great. They make life worthwhile. And that's pretty much all I got to say. I mean, I enjoy being a grandfather and a father.
My name is Ronald Baldwin, and I'm speaking on behalf of my grandkids. You know, the world has changed a lot. I'm only 58 years old, but right now I'm taking care of grandkids. They live with me. I take care of them day by day, week by week, year by year. And I don't want to let them down. You know, as a father myself, and being raised from a good family myself, I know the world is changing, and I don't want to let my grandkids down, or either my kids.
Yes, sir.
And I put all my faith in God, reveal that everything is going to be okay, and I keep moving every day, just day by day. I take it day by day, and that's what I do, and I love them all. Love all my grandkids.
All right, the best part about fatherhood for me is I just love to wake up in the mornings and see my daughter and try to set the best example as possible for her. You know, show her what life is really about, how much daddy loves her.
You know, for better or for worse, your kids, they'll do everything that you do. They'll copy you to a T. So it really makes you examine, you know, who you are and who you want to be, so that you can be the best example for them. So that's what I'm trying to do, is be the best that I can be. There it is.
Hi, my name is Ron Jackson, and I enjoy being a father. Fatherhood is the greatest thing, the greatest gift that can be given to any man. To have kids, to take care of his kids, have a loving wife, and have a support system around them. It's the best thing this world has to offer. Everybody do what you're supposed to do and stay up.
My name is Terrence Craig, and being a dad is being responsible, taking care of what you got to do, your responsibilities, paying your child support, and doing whatever you got to do. Find your job, most of all, and keep working.
My name is Michael Peoples. What it means to be a father is to be someone who's very loving and caring and nurturing. And it's an amazing job and an awesome challenge to raise somebody up to prepare the next way of the future. And what it really means to me is preparing her and getting her ready for the world to be the best her that she can be. I always tell her that if she raises up and is no different and no better than I am, then it ain't good. So I raise her up to be better than I am.
So this is Chris Salmons, and the important thing to me about fatherhood is getting to do all the little things with my daughter. So something as simple as being here at Kroger. She's here next to me eating a cookie, but something's real simple, getting to see her face and do little things in life every day with her.
Okay, so that was our video there. I hope you guys enjoyed it. Moving on, in 2020, on behalf of the Fatherhood Collaborative of Hamilton County, I attended and completed the Community Leaders Institute. And every participant had to do a class project. And so we chose for the collaborative a research project on fathers' health, their parenting beliefs and practices. The reason for that is because there are plenty of national data sets on fathers and fatherhood, but very rarely does a local community have its own local data on fathers. And I sought to move down that path. So this was our project. It was called For Fathers Only. It was a survey-based research project where we invited fathers to participate in this virtual event. And upon attending the event, they would fill out the survey at registration. And so that was our data collection. And at that event, we had about 21 fathers complete the survey. So we were very, very pleased with that outcome. And so now I just want to give you a brief glimpse at the survey so you can see the type of data that we're collecting. We're looking at overall health, the last time you've been to a doctor, how they describe their health, conditions they may or may not have had, again, tobacco use. And then we move into parenting beliefs and behaviors about fatherhood. How would they rate their effectiveness, how confident they are, and then what were the most important things to them as a father. And then some areas that we thought, and this is all research based, every question came from preceding research that we use. So this is a very valid survey. So then we held the event was on October 20th, 5:30 to 7:30. It was on MS Teams, a virtual event. We had presentations from 3 UC Health physicians, and the focus was physical, mental, and emotional health. The idea was to get these fathers in front of practitioners, physicians, so they could hear about these topics, but more importantly, ask questions to understand themselves better in these 3 areas. So we did the 2-hour event, and what I'll have next for you is a assortment of clips from that event on MS Teams.
But I think it goes without saying the best thing you can do as a father is to not smoke at all.
I'm being like super honest with everybody here.
You know, what I am passionate about is how just mental illness and mental well-being impacts the rest of our health as well.
I did some things that hurt, and that hurt other people, and that hurt my children also. But I just wanted to show people that I want to do better, and sometimes I hold it in. Yeah, I had a baby, and my first son at 13 years old.
The information I can give you is that smoking is bad for you, it's bad for your family, and it'll kill you earlier than you need to be killed.
So you have a connection. I want you to leave this meeting with a connection.
But I think fundamentally, it's the idea that you live in a society where you're seen as less than someone else.
Just address the elephant in the room, or those stress relief breaks. And dude, right now, I'm just glad just to talk to y'all because I hold a lot in.
And the first thing that has to be in balance in order to maintain that power is the balance of the mind.
Well, right now, she always tell me to express myself, and some of my family members tell me to express myself, but I just hold it in. It's like that pride thing. I don't know what it is.
It's like I need all y'all in a call by myself.
So LaDon, you can contact me.
Sometimes you can't tackle everything just by yourself.
And I just appreciate you putting it out there. And I just wish you the best in whatever you do for you and your family.
All I want to just say is I love all y'all, man.
We want to be involved with you while we're learning from you. Let it be known.
Let it be known.
Let it be said.
Let it be said.
This father keeps it moving ahead. Real father for life.
Real father for life.
Okay, so before we move away from this, I was remiss. I have to say that our survey was developed with the support of Teresa Adams, who was our Community Leadership Institute technical assistance provider. We had the support of Eric Rademacher, the co-director of the University of Cincinnati Institute for Policy Research, and Fatherhood Collaborative member Jay Coleman. All worked very hard to get that survey together.
So Calvin, can I just jump in here really quick, just to point out that the work Calvin is doing is, like I said, a funded position through JFS, part-time position. Right now, the work that you're seeing and the level of involvement really has been because of Calvin's unending work and commitment to this work. And so I just want to point out that a lot goes into the work that he's done with the collaborative and participation through the universities that are assisting us with some of the research study work, and also external funding from Greater Cincinnati Foundation, other sources that have helped us along the way. And we continue to want to make sure that we express, particularly to the commission, that we we have a dedicated individual in Calvin to continue this work. And we want to make sure that we can work towards expanding the efforts of the collaborative in that manner as well. So just wanted to indicate that as well.
I appreciate that, Mike. So in 2020, yes, is there questions or comments?
No, go on.
Okay. So in 2020, we did submit our six-month progress report for our community leadership grant, and that was well received. We also submitted our letter of intent for the CCTST 2021 Partnership Development Grant, which is $5,000 and would represent an opportunity to build a partnership with an academic organization to take the current research we have going on with the Forefathers Only and take that to the next level. The academic partner for this would be Ohio Guidestone, and you'll hear a little bit more about that in a minute. Preliminary research question for our next level grant is there an association between non-custodial fathers' mental health and their access to and parenting time with their children? The full proposal is due on the 21st, a couple days from now. We did receive, as Mike mentioned, a $5,000 grant from the Hale Foundation. And the Father's Feeling Study, we were introduced to the Father's Feeling Study by Brittany Pope, who's the Director of Applied Science and Research at Ohio Guidestone. The background on that is that paternal depression is a factor in child maltreatment and neglect. And currently there exists no tools to specifically measure depression in fathers who are expecting or who have children in the first year of their life. So Brittany Pope presented her research to the Fatherhood Collaborative. She got inspired by our desire to be involved in it. At that time, the research was Cuyahoga County only. Ohio Guidestone is located in Cuyahoga County, but spurred on by our enthusiasm, Brittany Pope requested funds from the Ohio Children's Trust Fund to make the study statewide. That was approved. She got the funds, and now Hamilton County is a participant in the Father's Feeling Study, which was previously named the Paternal Depression Study. 2021, what we're looking at, Father's Feeling Study, we're going to go full bore on that. The recruitment period started December 20th. It ends April 1st. The overall study goal is 100 fathers. I'd like to see the collaborative and Hamilton County provide 1/5 of that goal. We also look to develop the Fatherhood Collaborative of Hamilton County communication strategy, which means the website being redeveloped, the social media presence strengthened, and executing podcasts. Further, we want to complete our CLI grant funded project, the Forefathers Only. The next event for that is scheduled for March 9th, again, with the same 3 UC Health physicians. We want to analyze that data and then report to the community. I'm really excited that we'll be able to have local data that programs, institutions, organizations can react to as it relates to the needs and aspirations of fathers. 2021 will see us implement the inaugural Hero Award. Sigma Gamma Rho Sorority is running a fundraiser for the collaborative. That will happen in June. Then we'll launch the second phase of our fatherhood research, the Partnership Development Grant with Ohio Guidestone that we talked about. And then we want to connect fathers in the community to the Fatherhood Collaborative of Hamilton County. And we're going to do that through our father-to-father virtual discussion groups. We had 55 fathers register for the Forefathers Only event. So we're taking all of those email addresses and we made a contact list. And so we're going to send out a monthly invite for those fathers to gather. And then we're going to let that build organically. It's going to be about what the fathers want to talk about. If there's expertise or resources they want to bring to them, we'll do that with them as well.
And just to point out, when we were having the fatherhood virtual meetings every other month, 2018, 2019, 2020, we were up to approximately 24 participants per meeting every other month, representing about 18 different organizations. So part of what we want to try to accomplish is to expand that to include more organizations, more people, and obviously more fathers that can participate directly in that monthly meeting. Calvin does an excellent job of preparing the agenda. So the content feedback that we've gotten from from our participants has been very positive, that the agenda, the content, the information that's being shared, just like you're hearing today, is relevant. It's based in evidence. It's based in fact. Again, the vision for the collaborative is not a program. We're not funded through JFS federally or statewide to provide any services along these lines. So we don't do any direct programming, but we do bring the partners together to talk about what is available to fathers in the community in terms of services, in terms of hopefully research. Local research is really where I've asked Calvin to focus his time and energy. And I think that comes through in the presentation as well, to think about how there might be some unique needs for fathers in our area that we may not be aware of, but we can certainly share in the setting of a collaborative. So again, this is relatively new, and I just want to point out that Calvin at this point is still part-time, and so we have opportunities to do more here, and I think that's really where I want to drive this year and the next year, is to thinking about how we might be able to expand this work and bring more attention to this work. So part of our communication strategy that Calvin just mentioned also is hopefully getting in front of you as the commission, so that you're aware of what's happening from a county perspective and what's happening with our collaborative from a county perspective. And so you have an understanding of where things are, where things are going, and obviously get the good news of the work that's happening in Hamilton County as it relates to fatherhood. So thank you.
Thank you so much. Such great hard work has been done, and I'm sure so much more to be done for such a great purpose. And so I'll make some comments at the end, but I'd like to open it up for Vice President Reese if she'd like to make some comments about the presentation.
Yes, thank you, Madam President. Thank you, Michael and Calvin, for the presentation, and also the clarity in terms of what the role is, because when people hear Fatherhood Initiative, obviously the first thing, people look for direct services. What can you do to help me? But I think it plays an important role of, I believe my colleague Tom West used to be on that board, or played an active role at the State House in helping us get that together. But I do think the data is a very important part. It will be very helpful to us to utilize that data as we are making decisions. I know this budget is gone, but as the next budget, which I'll be able to participate in at the end of this year, it helps us make decisions on where we need to, where we can be helpful and impactful. Only thing I would just add is in the data, if there's possibility for it, and you may have already thought about this because both of you are very forward thinking, I like to see the thing about COVID. We hear a lot, obviously, about, we're in purple and stay home, and some people's homes are not the best conditions to stay in. So when we say go home, some of them, maybe living not in a stable situation, or their home is just not not the best place to be staying in all day, every day. So I would like to see in the data collection the impact of COVID on fathers as it relates to employment status, small business. I know some fathers that own businesses that have lost their businesses, or just the other day, a barbershop that's been around for a long time had to close their doors because the people there couldn't do the booth rent anymore, and the people that own the place said they got to shut down. And this gentleman was worried because he's a father. How is he going to take care of his children? So I would think as we look at COVID and we look at the health impact, and of course we have different segments, small business, et cetera, social services. I would like to see, and we do a lot with mothers, single moms and those kind of things, but there's fathers out here, there's single fathers out here as well. And I'd like to just see if that has had any effect on them. You deal with mental health, you deal with their economics, all those kind of things. So there's very few that I have seen, very few programs for good fathers that are out there. It's kind of like you're on your own, and if your economics change, we don't really care. you have to figure it out. So, and then some people have pride. They don't want the help. They're a father and they're supposed to be taking care of everything. So I would like to see what the effect of COVID has had, and it won't be now, but certainly down the road, we look back to say, what effect did it have on fathers from a mental, from an economic, from a relationship with their children? Because I even hear visitation is tough, because sometimes they'll say, oh, the mom may say, there's COVID. I don't want them going to visit you now. And I've heard from fathers who have said, whether that is accurate or not accurate, it has affected their visitation and relationship with their children. So just want to throw that out in your research, and would love to get data as you're out there researching and talking to fathers.
Thank you.
Thank you. Commissioner Driehaus.
Yeah, thanks. Just want to thank you for doing the work and bringing the attention that you have to this important issue here for the county, and look forward to how you are going to progress and our role in that. Trying to make sure that you've got the resources necessary to continue on. So thanks again for the presentation. We'll look forward to hearing from you again.
Thank you.
Thank you.
Thank you. The 1/21/21 deadline for the grant. Who is the grant through? Is that a state grant?
Actually, it's from the University of Cincinnati, CCTST, and I
Okay.
always bungle that acronym, but it's the I'm not even going to try. But yeah, it's from UC, and they have 3 levels of funding. So we achieved, by completing the CLI class, we achieved the $1,500 level of funding to do our forefathers only. Now we're going for the $5,000 level to build a partnership with Ohio Guidestone to look at the issue of mental health around access to and parenting time with children. And then next year, that makes us eligible for the $20,000 grant to continue the
Yes, that's where I was going, like 5,000, 1,500. This is such an important issue, and it tugs at my heart so much as we look at our young children and the impact of fatherhood. And as I looked at the video that you guys did, and some of the fathers said they want to provide mentoring, they want to be loving and caring and provide direction. And if those things are not provided, then we end up with those young people that are either dropouts, or they're in the justice center, or they're homeless. So these things are so important to our young people. And I think I'm just such a strong proponent that we need to put our money where our mouth is. And we need to recognize, and I believe the county has in certain ways, but just in general, the importance of our young people and not getting those things where they end up and where we want them to end up at all. And I think about our budget in general, and our public safety budget is about 70% of the whole budget, maybe a little less, a little more, but right about that amount. And so I think to myself, if we were providing more of that fatherhood mentoring and those things that they said, would we need as many or as much money toward public safety? Because we'd have more young people that are going down the right road because we taught that. So that I'm on my soapbox on that, but I just want to let both of you know that it's extremely important to me where our young men and young women end up, and programs like this will make a difference. And we have to put our money where we think that priority is. And for me, this is a very high priority. So I wanted to share that with you. I don't have any other comments as it relates to that. Just thank you for what you're doing with the little bit of finances that you have, and Calvin's working part-time and doing such great things that maybe even a full-time person would not have been able to do because of your commitment, both of you that are committed in this area. So just want to thank you guys. I'm glad that you gave us an overview so we'll know moving forward and have a better understanding where we'd like to go as a commission.
Thank you so much.
Thank you so much.
Okay, thank you. With no further comments coming forth, we'll go to item number 3. And item number 3 is a resolution appointing Quentin Monroe in the office of the Board of County Commissioners. This position actually would be in Vice President Alicia Reese's office. So would you like to speak to this issue?
Thank you, Madam President. Yes, so getting my office together, and excited to have Quentin Monroe come on as my chief of staff. Quentin has had a lot of experience she's been in the banking world. He's been understands small business, been in the small business world, has been a leader at Central State. He's been very active with what you call the millennial leadership, and has also been trained previous administration that was selected to be there for a White House internship. So I'm excited to have him, and looking forward to getting up and running with my office. So.
Okay. All right, thank you. Any further comments? Hearing none, I'd like to make a motion. I'd like to move that the resolution appointing Quentin Monroe to the office of the Board of County Commissioners.
Second.
You're muted.
Oh, not me.
My apologies. Commissioner Summer Dumas?
Yes.
Commissioner Reese?
Yes.
Commissioner Dreehouse?
Yes.
Okay, thank you. Welcome, Mr. Monroe.
Thank you.
Mm-hmm. So our next item of, we have actually two executive sessions, item 4 and item 5. And item 4 is executive session pursuant to RC section 121.22 G2 to consider the purchase of property for public purposes, the sale of property at competitive bidding, or the sale of other disposition of unneeded, obsolete, or unfit for use property. And item 5 is executive session pursuant to RC section 121.22 G3 to conduct a conference with an attorney to discuss pending litigation. Is there I move to executive session?
Second.
Commissioner Summer Dumas?
Yes.
Commissioner Reese?
Yes.
Commissioner Dreehouse?
Yes.
Thank you.